This is Breakthroughs, a podcast from Northwestern University Feinberg School of Medicine. I'm Erin Spain, host of the show. In recent weeks, with the emergence of the Omicron variant, the CDC's guidance on who should get COVID-19 boosters changed quickly, from just select groups to now everyone over the age of 16. But what do we know about the effectiveness of COVID-19 boosters, and how might boosters better protect us from new variants such as Omicron? Here with insight is Alexis Demonbreun, Assistant Professor of Pharmacology at Feinberg and the author of a new study that found COVID-19 boosters seem to supercharge antibody response. Welcome to the show.
Hi, Erin. Thank you so much for having me today.
The study about boosters that we're going to talk about today comes from a subset of participants in a Northwestern project called the SCAN study. Now, Dr. Beth McNally has been on past episodes talking about this study, but give me a refresher on SCAN and how this study has evolved from early 2020 to today.
Basically, back in March, when the pandemic was just starting, we teamed up with Thomas McDade, Brian Mustansky, and Rich DeAquila to get SCAN started. And so basically what we did was we wanted to look and see what the seroprevalence of COVID was in Chicago. So at the time COVID just came around, it was really hard to get testing. And a lot of the medical providers actually were suggesting if you were not severely infected to just stay home and quarantine. And so the numbers that we were seeing from the clinical testing, we assumed was actually much lower than the actual incidence in the community. And so what we did was we actually developed an assay in the lab to actually quantify the antibodies, the IgG antibodies against COVID-19 as a measure to look at the number of people that were infected in Chicago. And so basically our unique take was that we actually were able to do all of this without contact. And so we actually would mail participants kits so that they could sample their blood in the safety of their own home and not have to come out to the hospital to get a blood draw, which is normally like the standard way you do serology testing. And they were actually able to just mail us their blood samples back. And right in the lab, we were able to analyze the samples and look for these IgG antibodies against COVID. And what we found originally was 18% of Chicagoans actually were exposed to COVID, while the clinical diagnostics was only showing around 2.5%. So there was a 7-fold increase in those Chicagoans that were infected. COVID continued. We knew vaccines were eventually going to be coming, and we wanted to use this platform to watch the antibody levels over time and then eventually evaluate the response to these vaccines. And now here, boosters.
On November 21st, your team published preliminary findings from a small group in the SCAN study that had received boosters, and you showed that these boosted individuals had supercharged antibody response. Tell me about this study and the findings.
Over the last 18 months, we've had over 10,000 people join SCAN and participate, giving us our samples. And we ended up having these 33 participants qualified for boosters early on, receiving their boosters in September and October of this year. Since we had their previous vaccination samples, we were able to compare their levels from receiving dose 2 boosters, waning over time to immediately before receiving the booster, and then 7 days after their booster. And what we found was, on average, the participants' antibody levels increased 25 times higher with the booster vaccine than the levels they had just the day before. And what was shocking to us was that these booster levels were actually 4 times higher than their maximum amount of antibodies they received after their second dose of vaccine. So that's why we're saying these are supercharged. Getting that extra boost is giving you an extra, well, as you say, boost in your antibody levels. And so we were super pleased to see that high of a response in our population.
Were you surprised by these findings?
We definitely know boosters work. So we were anticipating we would see, increase in antibody levels over time. This is very reminiscent of our previous data where we had seen people who had natural infection of COVID-19 had a more robust response to their dose 1 and dose 2 vaccinations, which was equivalent to us receiving, those who didn't have COVID, a third dose, right? So we were anticipating that, yes, we would see a robust response, but a 25-fold increase was just absolutely astounding. We were just anticipating that this third exposure would elicit a response much quicker. And so we looked at 7 days, but guessing if we were to look at 21 days, this might even be higher than 25 times.
Do the findings suggest the booster protects for a longer duration than the 2-dose regimen alone?
That's what we're anticipating. We all know that the antibodies have waned over time and there's a standard half-life to antibodies. And so what we're expecting is, since these antibodies are starting at a much, much higher level, that it's going to take them longer to decline, giving us more protection.
What did you see in the SCAN study? How much did the antibodies wane?
Actually, very similar to what the manufacturers are reporting. We are kind of seeing a half-life of around 30 to 40 days, starting out really high when, depending on what variant, still gave us a lot of protection. But we're looking to see with these boosters if the half-life is going to be similar or not, and that's going to be determined in the near future.
We're hearing a lot about Omicron and how it seems harder for the vaccine to neutralize this variant versus other variants. Explain what we know about Omicron, and do you think boosters will provide enough antibody response to fight it off?
We know Omicron has a number of variants, actually a large number of variants, both in the receptor binding domain, which is the area that the antibodies are targeting to try to block the virus from entering the cell, as well as variants outside of that region. And so similar to Delta, we know that having a large amount of antibodies, although they weren't designed necessarily to these variants, having more of them was sufficient to actually to protect against the variants. In our preliminary data, and similar to what Pfizer has just released, they are showing that, yes, having this robust response after the booster vaccination that elicits this huge increase in antibodies was giving us protection against Omicron, even though those antibodies weren't designed specifically to that variant.
What has the reaction been in the scientific community and the media to this study, the small study that you just put out a few weeks ago?
Actually, we're having a lot of positive feedback, and we're hoping to get it published in a peer-reviewed journal. But most importantly is we've had a lot of media attention, Twitter retweets, news attention, newspapers writing about it, getting it out to the public. And that's exactly what we want at this time. We want to show the public that these boosters are working. We have faith in them. Our testing that has nothing to do with the manufacturers are, showing similar results, and that we need them. Like, go out and get a booster.
Well, there's good news. According to the White House COVID-19 response team, vaccinations have surged, with about 12.5 million shots administered over the last week, including 7 million booster shots. Do you plan to do a study on a larger sample of booster participants now that boosters are more common?
We're definitely hoping to expand beyond our smaller 33-person study. We have many people already enrolled that we have their pre-vaccination serology on, as well as their responses after dose 1 and dose 2. And so we're hoping to actually be able to look at the booster response over time to calculate out how long we expect these antibodies to last and when we might anticipate needing another booster, if we need another booster, which, we're hopeful, but it's probably coming down the pipeline. We're very excited to expand our work and continuing studying these vaccine response.
I want to touch on another study that you published in September in the Journal of Infectious Diseases. Your team investigated whether the antibody response to COVID-19 mRNA vaccine is similar in men and women. What did you find?
In that study, we evaluated the antibody response in men compared to women, as you said. And originally, just looking through the database that, the app that you are asked to join when you get vaccinated, women were reporting much more symptoms after vaccines than men. And so we questioned whether those symptoms correlated with a more robust response. And with other vaccines, this has been seen that women do have a higher immune response against vaccination. And so when we looked after dose 1 as well as dose 2, we did in fact see there was a significant increase in antibody levels in women compared to men. We were looking to kind of continue on and see if that has anything to do with breakthrough infections or longevity of these antibody responses, and then additionally doing the same thing with our boosters now.
What is it about women that makes this response stronger?
A lot of the immune genes are on the X chromosome, and since women have 2, we actually can mount a higher response.
Before SARS-CoV-2, you spent a lot of time working on muscular dystrophy. Tell me about that research, how you've been able to continue it, and have you been able to link the COVID-19 research with your muscular dystrophy research?
Pre-COVID, I definitely had a scientific focus on muscular dystrophy, looking at muscle regeneration and injury repair. In regards to COVID, what we actually did was we enrolled about 15 neuromuscular patients into SCAN. And the reason behind this was many patients that have neuromuscular disease are on chronic immunosuppressives. And it's known that obviously immunosuppressives can reduce your response to vaccination. And so we wanted to use our quantitative assay and see how well this population would respond to COVID vaccines. And importantly, we found that all of the participants really did have a great response, much higher than even after COVID natural infection. That was super exciting to us that we didn't really see this huge decrease in antibody levels if you were taking steroids, suggesting that all these populations should actually still go out and get their vaccines, get their boosters, and it'll help protect them.
Is there hesitancy in that group?
People are afraid that the vaccination could exacerbate their symptoms, or if they're already having a lot of these severe muscle atrophy and aches, how is the vaccine is it gonna do any good for them, or is it gonna make their disease worse? And although our study was really small, we really didn't see any adverse events or people complaining worse than the healthy population on their symptom severity or how long they lasted. So that was a very big positive.
I want to talk a little bit more about the SCAN study. What has it been like to be part of such a big and unique project that really is a truly Northwestern project, everyone involved? Just give me your take on what the experience has been like.
It's been absolutely wonderful and eye-opening. I've never been involved in such a wide community-based study before. Hooking up with Thomas McDade and Brian Mistansky and Rich De Aquila, and of course, Beth in the Center for Genetic Medicine, taking all our different expertise coming from basic biology to anthropology to public health and mixing all of our expertise, I think has really given us the success that we've had in this project and really allowed us to make a big impact on understanding the antibody response. It was just really great to see how many people in the community actually wanted to participate and were excited to participate and really wanted, to be informed about what's going on. Originally, we had almost like 40,000 people request to be enrolled. And so based on all of our criteria, we actually were able to enroll like near 10,000. So we know Chicago is very heterogeneous. And so with SCAN, we definitely tried to get a good representation of what Chicago looked like with different ethnicities, genders, age, basically just representing all of Chicago. And shockingly, we actually were able to meet that goal. And we did enroll a very diverse population, making our study really important for our population.
This could be used as a model in the future as a way to bring more people into clinical trials and studies because it didn't require them to come. Do you see the dry blood spot becoming a popular way to gather information?
I absolutely do. It's used a lot in the anthropology field and obviously is used a lot in the pediatric area. But I think in our world moving forward, having a way to get samples back and forth without requiring people to come to the clinic, putting that extra burden on the healthcare system and even on the participants themselves. A lot of older people might not be able to have the means to get places. This is just a very convenient way to do a true population base, not subject ourselves to who might be able to get to a hospital or be near a hospital. I mean, you can mail things just about anywhere these days. And so, yes, I really do think that this is going to be really important moving forward.
Well, thank you so much for coming on the show, explaining this latest research and sharing some of the other work that you've been up to.
Yes, thank you so much for having me. And I hope we can chat again as we acquire more information and data over the next couple months.
Thanks for listening. Be sure to follow us on Apple Podcasts or wherever you listen to podcasts. And if you're a member of the medical community, you can claim CME credit for listening to this podcast. Go to our website, feinberg.northwestern.edu, and search CME.